and welcome to Counseling 174. Today we'll be talking about cognitive behavioral theory. Let me give you a little backstory. I'll be talking about Letty, a 28-year-old Latina student who dropped out of school because she was depressed and unfocused with her schoolwork. Back in the day, when she was 17 years old, her mother left her to watch her younger sister who was 14. Letty was molested by her father and grandfather on various separate occasions. Her mother and grandmother did not believe her. Now she is suffering. She is now having a reoccurring dream where an older man is teaching her how to swim. She sees her mother from afar on the shore with a man she doesn't know. Then she turns into a mermaid, and as she swims away, she gets caught in a trap. We need to help her. Letty's intake from these goals from therapy is that she wants to tell her mother that she hates her grandfather and uncle and that she wants to get back to school. She will not be with her uncle and grandfather at family gatherings, and she'll start a new relationship with her mother. Using CBT, this will show how we will achieve it with the 3 branches of CBT, which are behavior, feelings, and thoughts. We'll focus on herself, others, and her future.
Today, how are you feeling?
I'm okay, I guess. I'm just struggling with a few things. Not really sure where to begin with this.
Okay, alrighty. Would you like to tell me what's on your mind right now?
Right now, I had to drop out of school. I was having a lot of trouble focusing in my classes. I was having a tough time keeping up with assignments. Just wasn't keeping up, and I just feel drained, and my anxiety's been pretty bad. Just felt a lot of nervousness. I've, been feeling a little bit depressed, to be honest.
Okay. So, since you stopped attending school, do you still have these symptoms come up of anxiety and your nervousness?
Yeah, I would say I still feel anxious. I mean, hasn't really gone away. Been experiencing some shortness of breath. I think sometimes I could feel like my heart beating really fast. It's like rapid. And I don't know, sometimes I get really freaked out. Like one time I thought I saw my uncle at the store, and I don't know, I felt like this overwhelming rush of fear and felt anxious. But when I realized like it wasn't him, I started feeling really bad, like pretty depressed about it.
So walk me through your average day. When do you start to feel sad or anxious?
Yesterday I was getting ready for work like I usually do, and I was getting dressed, and I don't know, I don't really like looking in the mirror, but today I kind of took a glimpse, and I don't know, I didn't like what I saw. I felt ashamed, sort of embarrassed. I don't know, I had this overwhelming feeling, and I just felt so gross and ugly.
Okay. Would you feel comfortable doing an activity on the board with me?
Yeah, I think I can give it a try.
Okay. All right, great. Okay. You said your activating event would be you look in the mirror, right? And you said you didn't feel your best. So look in the mirror. Okay. And your belief, you just told me you felt ugly. So that would be that your belief, what you're feeling, what you're thinking.
Yeah.
So I am ugly. Okay. The consequence of that is that you felt sad, depressed all day, right? It affected your whole day, you had said. Okay. So now I want you to list 3 positive qualities about yourself. Can you give me 3 things that you like about yourself? Let's do it.
I think I'm friendly.
Okay, so you are friendly, right?
Yeah.
We don't think we are friendly. Okay.
I'm kind.
Okay. Okay. One more.
I think I am caring.
There you go. Okay. Do you notice how none of these have anything to do with your appearance here?
Yeah.
So can we tentatively agree that you are not ugly?
Yeah.
Yeah? Yes?
I think, yeah,
we can
agree.
Can you write it with me? I am not ugly. Can you write that with me? Can you say it with me? Yeah. I am not ugly.
I'm not ugly.
Okay. I'm not ugly.
I'm not ugly.
Thank you. So let's go ahead and have you continue to tell me about your day yesterday. After we looked in the mirror and felt kind of sad and anxious, what happened next?
I don't know. I mean, I don't know, I just get depressed, and I went to work, and I went to the bar afterwards, got a few drinks.
Okay.
Felt good at first, but then I started to feel sad,
Okay.
kind of guilty, because
Okay.
my mom called earlier and I ignored it. You know, I just kind of stayed aside.
So let me address the bar. Do we go there often to have a few drinks, daily, weekly?
I would say I go daily. I mean,
Okay.
I like to go whenever I get out of work, or anytime I just feel like I need a drink.
Okay, you feel like you need a drink. Why are we feeling we need a drink?
It kind of makes me feel better.
Okay.
I mean, it helps for a little bit. It kind of
So
makes
does
me
it
feel numb.
relieve
Yeah,
anxiety?
I would say yeah, it does.
Okay.
It helps out. But then
When
it
you're
goes
sitting
off.
at the bar, what do you feel like? You feel happy? Are you stoked to be there? Are you missing home? What are you feeling?
I'm happy at first, but
Okay.
then I get pretty sad, bummed out. I think afterwards, when I realize like I'm kind of there by myself.
Okay. A little lonely, maybe?
Yeah.
Okay. So I have another little homework assignment for you. Are you up for it?
Yeah.
Nothing too tough. I'm going to give you a journal when you leave here.
Mm-hmm.
And I want you to write down your feeling the second you decide to go to the bar. Okay, so maybe it's after lunch, it's 2 o'clock, your day's almost over, and you're like, oh, I'm going to go to the bar. Write down your feeling before you go to the bar, and then while you're sitting there. So you're sitting there, you get your drink, or how do you feel? Are you feeling happy, numb, excited, sad? Okay, and we'll just have to do that until next week when I see you, each time that you're at the bar. Does that sound like you can do that for me?
Yeah, I can try that out. I can do it.
Okay, we're just going to kind of gauge and see how you're feeling and figure it out from there, okay? Is there anything else you want to address before we end for the day?
Well, I ignored my mom earlier, but I kind of want to maybe fix that relationship with us. I feel like we don't really have a healthy or good relationship.
Okay.
I mean, I haven't spoken to her in a long time, so I don't know, it's just kind of awkward talking to her.
Okay. So can you define your definition of a good or healthy relationship?
I mean, for me, I mean, we've never been really close, but I think healthy or good for us, for me, I'd be content with at least being able to say hi. I mean, not deep conversations,
Okay.
but, you know, at least some conversations, so at least I know what's going on in her life, and she kind of has like a, you know, she knows what's going on in my life.
Absolutely. So maybe just making contact, being a little bit more involved.
Mm-hmm.
Okay, just so you don't feel so, you haven't spoken to her in, gosh, you know, however long, and you don't know what she's up to or anything.
Yeah.
Okay, so our goal is going to be to make contact with your mom.
Okay.
Now for us, we can take baby steps, and making contact may be a simple text message. Hey mom, I hope you have a great day. Or it might be a phone call this next week. Hey, just checking in. Or it could be a visit. Where do you feel like what are you ready for, possibly?
I think I can text her.
Okay.
I mean, I'm not sure if I'm ready to call her, but I think a text is pretty okay.
Okay, so our goal is to stay comfortable, make a little bit of contact with your mom, send her a text saying, you know, hey, how are you, wherever you guys communicate, and then we can work from there and build you guys a healthy and strong relationship. Does that sound like a good plan?
Yeah, that sounds perfect.
Awesome. We can do that together. I look forward to our progress.
At the beginning of a session, the therapist directs the client to focus in the present moment of their life. Instead of having an open conversation as a typical session would be, the therapist and client come up with a set of topics to talk about.
The topics that the client chooses to talk about are problems in which are happening at the moment. The therapist then finds a way to help the client solve their problems in the way that either changes the way the client perceives the problem or a way that the client can avoid it from happening again.
With the cognitive behavioral theory, you could also incorporate the ABC theory of personality. This model can be described as I think, so I feel, and I do. To further explain this model, the A is recognized as an activating event or objective situation. For example, the A, for Letty, can represent her believing that she saw her uncle at the store. The letter B is the beliefs Letty would have about her uncle and the negative thoughts that have occurred. With this being said, Letty states that she feels fearful and sad towards him. Next, the C is the consequence, meaning that the emotions and behaviors that follow from the beliefs. Some questions to ask the client would be, how did the act go then? What did you feel then? In other words, Letty would probably choose to avoid and ignore her uncle the next time she thinks about seeing him. Another intervention to help Letty deal with anxiety would be to keep track of these feelings, thoughts, and behaviors, to become aware of symptoms, and to make it easier to change the thoughts and behavior.
Cognitive behavior therapy focuses on teaching you coping strategies to deal with problems and challenging those thoughts that interfere with the effective of coping. In order to keep track of Letty's own feelings and thoughts, this intervention, using a chart to monitor the frequency of these events, the therapist uses the client in order to view the relationship between pleasant events and moods so that the frequency of the pleasant events can be increased while the frequency of pleasant events is reduced during the therapy sessions. The therapist may also use a dysfunctional thought record, which is a technique that shows self-talk and negative interpretation of events in order to help client recognize distorted thoughts and replace negative and irrational thoughts with more adapted ones. As well, an intervention that can be used to help Letty overcome her alcohol intake are some coping skills and behavior alternatives in which are developed and practiced in therapy to handle situations in which the urge to drink arises. Any irrational thoughts associated with drinking are also challenged during the therapy to increase the mood and self-esteem of the client, which in turn helps to control drinking behavior.
CBT focuses on the here and now, and one of the ways this is done is by helping clients with their goals. One way to help clients achieve their goals is to give them weekly homework assignments. Letty has a goal of creating a new relationship with her mom. Since this is a big goal, it might help Letty to start in little baby steps, such as sending a text message or making a phone call as the first homework assignment. Since Letty's more comfortable sending a text the first time, maybe the next week she could work up to a phone call. The conversation doesn't have to be anything deep, starting out just something, how was your day, to get them comfortable with how the relationship is going. The next few homework assignments can be a little more bigger to help build that strong relationship, such as spending the day with her mom or going shopping. Just depending on how Letty is with her comfortability, these homework assignments could just help reach that comfortable relationship she's looking for.